in a bid to up the ante in the public health service in Nigeria. The Executive Director of National Primary Healthcare Development Agency, Dr. Faisal Shuaib, on Monday 6 September 2021 in Abuja, organized the third quarter meeting of the Northern Traditional Leaders Committee on Primary Healthcare Delivery. In his remark, he appreciated the guardians of the custodian of our culture and tradition to the model success of program in primary healthcare. While giving assessment of the phase 1 of COVID-19 vaccine rollout success, which was mainly due to the community sensitization and mobilization of the traditional leaders. With so much happiness, Dr. Faisal shared the one-year anniversary of a polio virus-free Nigeria, an achievement that possible due to traditional leaders of our communities.
Tradition. I must say that your paternal guidance over the years has contributed immensely to the modest successes that we have achieved thus far in primary health care. The first phase of our strategic COVID-19 vaccine rollout witnessed complete utilization of all available doses of vaccines due to your support in the sensitization and mobilization of the community for vaccination. The second phase, which is currently ongoing, will also require our traditional leaders to champion the cause towards vaccination and ensure Nigeria returns to normal living. We encourage you to use your influence to disseminate the right information and dispel any misinformation on the vaccines. Last week, we completed 1 year as a white polio virus-free country. This achievement is due to the collective efforts of all of you, our royal fathers, steering the boat of leadership to ensure vaccination is widely accepted by all.
No doubt, the country is facing different disease outbreaks, and this progressive approach must be sustained. Integrity mobilization, sensitization, advocacy, and role modeling effort should target multiple interventions simultaneously. In his final note, he admonished Nigerians through the traditional leaders to observe the COVID-19 protocol despite vaccination process.
With different disease outbreaks that we're currently contending with, it is imperative that our approach becomes more integrated. This is because they are all interwoven. Amidst COVID-19, we have cholera, we have CVDP2 outbreaks. These CVDP2 outbreaks is as a result of suboptimal routine immunization in part of the country, but primarily because of poor water and environmental sanitation. It is therefore very critical that as we conduct our outbreak response campaigns, we need to find a way to integrate our responses for efficient utilization of available resources and to enhance confidence in our people. Integration will also enhance our determination to continue to safeguard our white polio virus-free status. Consequently, Your Highnesses, mobilization, sensitization, advocacy, and role modeling efforts should target multiple interventions simultaneously. Your Highnesses, distinguished ladies and gentlemen, I want to humbly remind those who are yet to receive their second dose of the AstraZeneca vaccine that it is now available in all states across the country, while the Moderna vaccine is also available for those who are yet to be vaccinated. After vaccination, we want to encourage all Nigerians to continue to observe COVID-19 prevention protocols by wearing face masks, observe hand hygiene, physical distancing, avoid crowds and unnecessary travel until we're able to achieve herd immunity.
And in the same way, we need to come together to fight this, both the pandemic, the polio, and also to strengthen routine immunization. The long-term solution out of the recurring outbreaks is to ensure that all communities have the protection that immunization affords to them. I plead to you to continuously persuade the community in your Friday sermons, Quranic studies, and other religious fora, in your engagement with your constituents at community level on the importance of routine immunization, of which polio, COVID, and other vaccines are now an integral part of the primary healthcare system that affords to take it.
But before coming here, I heard a lot of great achievement that the country achieved through these kind of innovative approaches, building trust on traditional leaders to tackle issues that their own communities are facing. And I really want to congratulate you, the entire Nigeria, for contributing, number one, to end the white polio. This has been a worldwide success. I would like really to clap again, once again, for you. We are sure that this first step of success should not allow us to sleep and wait, as we need to continue. And we really welcome this kind of forum where people can continue to meet, reflect, and review on their achievement. So we at the Bill and Melinda Gates Foundation would like to reiterate our commitment to work with Nigerians, including traditional leaders, in their respective role to support the government initiative to strengthening primary healthcare service delivery.
Nigeria has one of the highest numbers of CVD-PV2s, the circulating vaccine-derived poliovirus. We also have the highest number of unimmunized children globally. Because we've been successful in getting Nigeria out to become wild poliovirus free, I believe, and I know the US government believes, that the traditional leaders, in your power and in your strength, you can definitely help us to break this transmission. You can help us to push women and caregivers to bring their children for routine immunization and increase the number of children that are vaccinated. As one of our dear colleagues mentioned, we have all kinds of outbreaks. If it's not cholera, there's CVD-PV2s, there's COVID-19. So there are so many outbreaks. And there are some basic things that we know you traditional leaders can really help us to do. Hand washing and keeping the environment clean and avoiding open defecation. We know if we did very well in these three areas in our communities, it can reduce transmission of infectious disease by almost 70–80%. So if we can get those things done, we will definitely reduce the number of infections that we're seeing. Second is to really encourage mothers and caregivers to bring their children for routine immunization. As we know, vaccines is one of the cheapest public health intervention anyone can ask for. In fact, it is the cheapest public health intervention that we know about. And if we encourage mothers and caregivers to come, you will help us improve routine immunization, reduce the number of infectious diseases, and reduce the number of morbidity and mortality that we see. I remember visiting Sokoto once, and to get the mothers and children to come out was not easy. But with the help of the traditional leaders, the community leaders, they made a difference. The moment they came in, the mothers and the babies and whoever was with those children were able to bring them in. So that made a big difference.
Gilbert Amaji, Voice TV, Nigeria.